Hi, everyone. My name is Martha Raymond, and I'm the founding executive director of the GI Cancers Alliance. We are a global alliance of over 50 member organizations, advocacy groups, hospital centers, academic centers, and wonderful industry supporters. And we represent all of the GI cancer disease states for our gastrointestinal cancer community. And I'm very pleased to be here today with one of our GI Cancers Alliance members and also dear friends from Fight Colorectal Cancer. So today I'd like to speak a little bit about our patient and survivorship care plan that we created. And in working with our friends at Fight Colorectal Cancer, very happy to be here to just give a little bit more information on the foundation of this patient educational tool. So if we could start the first slide, that would be great. So our treatment and survivorship care plan was developed in the fall of 2016, and it was a direct outreach from a member survey that we conducted of over 500 patients and caregivers. And to begin with, I'd just like to give a little bit of background on the GI Cancers Alliance. As you see, our vision is for a stronger, more unified voice to fight gastrointestinal cancers. And we realize, just like with our partnership with Fight CRC, that we are stronger when we work together. So at the GI Cancers Alliance, we work every day with our partners, with our member organizations, to provide the most impactful information that we can for all the gastrointestinal cancer community. We work to raise awareness, provide education, and advocate to prevent, treat, and cure gastrointestinal cancers. And as I mentioned, that's a true collaboration between advocacy groups, industry, and institutional partners. Next slide, please. So in the fall of 2016, as I briefly mentioned, we decided that we would create a anonymous survey that was conducted online because we really wanted to get a better understanding of what the unmet needs were in our GI cancer community. So we created an anonymous survey for a 6-week period. And during that time, we received over 500 responses to that survey. So it was a very, very good response. And as you'll see, we had many of the GI cancer primary tumor types represented. Every type of patient, from an esophageal cancer patient to appendiceal, colorectal, liver, pancreas, etc. So the results of the survey were very eye-opening to us, and again, really underscored the reason why we went ahead with the survey. And one of the resounding overarching themes of the survey was that individuals didn't feel that they had a roadmap, an understanding of where they were going in their treatment, and really felt that they didn't have much say because they didn't have the knowledge, the basis to ask the questions. They knew they needed to ask questions, but they weren't 100% sure what those questions should be. So one of the things we learned were that 92% of the patients surveyed didn't have a survivorship care plan. And I think really a very disheartening figure was that more than half, 52%, didn't even know what a care plan was or had never heard of a survivorship care plan. They hadn't been given any information from their healthcare team or things like that. So that, again, led us to say, okay, this is really an important topic that we can jump into and help, fill in those gaps for support services and patient education. Next slide, please. So with the unmet needs of the GI cancer patients survey, which was a call to action, we developed an abstract, and we're very happy to report that we were able to present that at ASCO GI, which was a great, a great step for us in alerting the GI cancer community overall about the need, for survivorship care plans and all of the unmet needs for our community. Next slide, please. So the elements of our care plan, which I know the Fight CRC group are working with as well, we really wanted to provide a workbook for our patient community so that they could customize, personalize the care plan and take that information and complete it with their healthcare team. And that's what many of our individuals have done. They've begun the care plan, they understand the needs, and then they've taken it to their healthcare team to help further complete it. So the basic information, we wanted them to be sure that they had all of their, their health information, including, their diagnosis information, all of their records, maybe from their CAT scans, from their diagnostic testing, etc. So with all of that information, they're able to complete the care plan, and then also provide information for clinical trials, different information on treatment-related side effects, and that includes both the physical and then the emotional psychosocial, so that patients, for example, they may be experiencing gastrointestinal issues, and they can say, okay, I experienced this 5 days out of the week, so that the healthcare team then knows, okay, this is a severe situation and we need to do something, to help this individual. Or on the emotional or psychosocial side, individuals could say, I'm really feeling anxious, I'm really feeling depressed, and I think I need to speak to somebody. This has been going on for over a month, for example. So really that roadmap to help patients understand their symptoms and then look for the help that is definitely out there. One of the other important aspects of the care plan is the financial and insurance related information. So many individuals, are struggling financially, and if there's any information that we can provide or help point them in the right direction to receive assistance or tools that they can use to maybe speak with their insurance company to better understand, what resources might be out there for them. Next slide, please. And then again, one of our other important elements that we wanted to include with the care plan was the post-treatment. So to really understand for patients, the goals of care to begin with, but then also understand that as they enter the survivorship period, maybe now they're not in active treatment, but so that they understand what that follow-up care will look like and the importance of keeping those important appointments for post-treatment scans, blood work, etc. And again, one of the very important parts, including questions to ask their physician. Again, patients know that they're supposed to ask questions, but just being given a couple suggestions, a couple other thoughts on what they can ask their physician so that they are true members of their healthcare team. Another really popular aspect of the care plan has been the glossary of GI cancer and treatment-related terms. Again, I think so many of us, you look for that information, but when it's all right there for you in a very patient-friendly resource, I think that's very important. So again, that's been a very popular aspect of the care plan. And as I mentioned, our goal, the overarching theme of the care plan has been to empower patients as they navigate the care continuum, and then educate patients about the available resources and support services. Next slide, please. And one of the things I would like to thank all of our GI Cancers Alliance members, including Fight CRC for sure, is the wonderful outreach that we've felt within our community. Cure Media Group is one of our members, and they've been wonderful about helping us get the word out about the care plan. And like I said, so many of our other groups have been right there as well to help us. And a few statistics in our reach for the care plan, which has just been great. Our impact to date has been over 7,500 downloads from our GICancersalliance.org website. and print copies of over 2,500 have been distributed. And one of the great features of the care plan, like I said, is that individuals can take it with them to their oncology appointments. And we've been able to work with individuals in support groups, focus groups, to help them complete the care plan if they feel like a little bit of information is needed along those lines. So we're very, very happy that we've been able to provide these plans free of charge, thanks to our wonderful, industry supporters, and look forward to continuing to make an impact in the GI cancer community. Next slide, please. And so at this time, I would like to say thank you to our friends and colleagues at Fight CRC for the invitation to showcase a little bit of our treatment and survivorship care plan. And we look forward to working with all of our members, including Fight CRC, as they continue on the creation of their care plan. And however we can help get the word out, we're happy to do that, in true collaboration and partnership. So thank you very much. And if you have any questions, please don't hesitate to reach out, gicancersalliance.org. Thank you so much.